My name is Dr. Dan Rogers. Welcome. I'm glad you're here. I've been practicing alternative medicine for more than 30 years. Started out originally doing what was called the Gerson therapy, and I do now what is called the Gerson Plus Therapy. I've added a number of items, about 15 extra protocols, 15 to 20 extra protocols that we didn't have originally, that actually help the patients to heal better. We looked at the first 18 years of the practice and found that 92.5% of the patients that came into the practice were end-stage cancer patients. We're talking about cancer patients specifically, but I also treat almost any other thing out there besides cancer. But with the cancer patients, we had about 92.5% of the patients were end-stage, extensively pre-treated and basically sent home to die. And even in that condition, we're able to save many of the patients, and you're going to see some of the pictures of some of those patients today. So let's go on ahead and get started. I believe in the Bible and what it says, and I'm a Christian, and so I start out right in the Bible. And right in the beginning of the Bible, God told us what diet we should be following. It says, I have given you every herb yielding seed, and every tree in which is the fruit of a tree yielding seed. To you it shall be for your food. This is the type of food that I usually give my patients: lots of fresh fruits and vegetable juices, fresh veggies, fresh fruits. And for the first 3 months, I started all of my patients off on a vegan diet. A vegan diet, for those of you who may not know, is no animal products whatsoever. That means no butter, no milk, no cheese, just fruits, grains, nuts, veggies, those things. This is one of the worst cases of an external melanoma.
Good heavens.
Melanoma usually kills fairly quickly. If you see all the bumps going up her arm, those also are tumors that extended up her arm, over her shoulder, on her face, on her back. She had hundreds of them. Look how large the tumor is, way beyond the red area on the tape that's there. And you can see here's her thumb. If you take a look right down here in the bottom, that's just her thumbnail sticking out. The thumb's totally encased. She failed to conventional therapy, failed to almost everything else she tried. At this point in time, you could not do any surgery for it at all. You'd have to remove the arm probably. If you look up her arm, you can see all the little bumps. Those are tumor masses going up her arm as well. After just a few weeks of therapy, the tumor is shrinking. You can see there the end of her thumb sticking out. It's actually revealing the thumb itself. And you can see that the tumor is almost within the red area of the tape. She went home. I didn't have any follow-up pictures. She came back about 1.5 to 2 years later, and this is all that was left. Arm totally cleared except just for some deep pigmentation, and that's what our nice young lady looked like. Totally cured, no surgery, no radiation, no chemo. This is one of the peer-reviewed studies that we published. I'm probably one of the few docs you'll ever meet that has published anything in U.S. scientific peer-reviewed literature. Most docs in conventional medicine never publish, even fewer in alternative medicine. My practice is outside of the country. I practice in Tijuana, Mexico. And for an alternative practice outside of the U.S. to publish in U.S. scientific peer-reviewed literature, almost impossible. We published 2 articles so far, both on melanoma. Have a third almost ready to go on ovarian cancer. But if you look at the results, we looked in the worldwide literature, not just in the U.S. Could not find any practice, any system, anywhere in the world that has 100% 5-year survival rates for any type of any cancer. This one, Gerson Plus Therapy, 100% for stage 1. As you know, most cancers are divided into 4 stages. 100% for stage 2, which is just amazing results. Diet alone, nothing else, no surgery, nothing else, just diet alone. 39% for stage 4 end stage melanoma, as compared with about 5 to 6% for conventional medicine. Huge difference. But if you add one modality, surgery, we ended up with 57% 5-year survival rates for end stage melanomas, just adding one modality. We looked at the first 2 years of what I now call the Gerson Plus program, and when we compared that with our database of patients who are doing pure Gerson, when you consider the type of patient that comes, which is usually late stage, end stage, extensively pre-treated patients, and then we put them on the Gerson program and they get better a vast majority of cases. Then when you add to that the Gerson Plus program, we found that we had at least a 25% increase in overall patient survival rates, which is a huge jump when you consider the patient base that we had. So that's why I recommend Gerson Plus therapy to everybody that I possibly can. The lifestyle you live, the foods you eat, the way you prepare your foods, very important also, play vital roles for the health of the human blood and tissues, states microbiologist Robert Young, PhD. If your foods are devitalized or contaminated with chemicals or metals, your blood turns into tissue that becomes compromised. Very important. This is very recent statements just in the last couple of years. It's not just the foods we eat that's important. Equally important is how our foods are prepared. U.S. Surgeon General. Ezekiel 4. Look back at the Bible again. Take wheat, barley, beans, lentils, millet, and spelt. Put them in a storage jar and use them to make bread for yourselves. This is a Bible recipe that has Laetrile B17 in it, and it's clear back from ancient times. That's a key food for Ezekiel. In fact, you can buy Ezekiel's bread today. It's really quite good. Here's a breast cancer. The white area you see there is a cream that the lady had over the tissue because it was just open wound tissue. There wasn't any skin covering it. And here you can see how deformed the breast was. Totally misshapen, not like a normal breast contours whatsoever. Here you can see granulation tissue already starting to fill in. And you can see that the breast is healing, the tissue is healed back in. Granulation tissue is forming there in the areola. And the breast is beginning to get normal contours again. After about 6 or 8 weeks, here she is with that one area totally healed in. And granulation tissue in the rest, and almost normal contours back on the breast again. Again, no chemo, no surgery, no radiation. American physician Dr. Virginia Livingston Wheeler lived and worked in San Diego. I knew her personally and was in her house numerous times. She reported that she successfully treated microscopic organisms she called progenitor cryptocytes. She further cited their source as the contents of certainly poorly cooked foods. So the cookware, the stuff that you cook with and how you prepare your foods is very important. Dr. Joseph Issels, who practiced in Germany and was a compatriot with Dr. Max Gerson. Actually, Dr. Issels tells me the story about how they met in Baden-Baden, Germany, and they were so excited to get to meet each other that they spent the whole night talking and then never did go to bed. But Issels always wanted to combine Gerson therapy and Issels therapy, and he retired, moved to Florida, and called me up one day and said, Dr. Rogers, would you like to work with me? And I said, sure. So they flew out to San Diego, and Dr. and Mrs. Issels lived in our home with us for about a month until they got their own place. And every week I'd take them down to the hospital in Mexico, and we worked together for the last several years of his life. But anyway, Dr. Issels also reiterates very similar to what Dr. Livingston said, and he calls them microscopic organisms. He calls them endobionts that are in the bloodstream, and how a person's lifestyle, what they eat, how they live, directly affects these and many other components of the blood in the body's immune system. For many years, researchers have been investigating how food choices can help prevent cancer, and when cancer has been diagnosed, how these choices can improve cancer, can improve the survival rate. Certain diets and diet patterns seem to have a major effect, helping people diagnosed with cancer to live longer, healthier lives. Other diet choices are risky propositions, increasing the toll cancer takes. This is what Dr. Neil Barnard, MD of the Cancer Project in Washington, D.C. said in 2003. So diet and lifestyle, we're beginning to hear this more and more. Back 1905, 1906, you're going to hear that. And now here it is just from modern times. Here's a non-Hodgkin's lymphoma. It looks like 2 separate tumor masses, one on his neck, one under his arm, right? One solid tumor mass connected right through the chest wall. Failed to conventional medicine, failed to numerous alternative therapies, including just pure Gerson. And if it wasn't for the Gerson Plus program that I started just before that, he probably would not have survived. Look at the date, April 10, 1996. You can see how much distress he's in. The veins are distended and sticking out. You see how huge the tumor masses are. Again, what was the date? April 10, okay? 2.5 months later, there he is with a walnut-sized tumor on his neck. The one under his arm was almost gone. Again, no surgery, no radiation, no chemo, 2.5 months. He stayed with us for another couple months. There it is, end of the arm, totally clear. Neck, totally clear. There he is in the lunch line, getting ready to eat, and here he is, happy camper, getting ready to head home. He's saying bye-bye to our nurses. So that's just another one of the amazing cases that happens on an almost routine basis during the Gerson Plus therapy. The anti-tumor effect, this is 13 charts that we looked at using the nutrition-based treatment as the sole influence, nothing else. No surgery, no chemo, no radiation, just diet, detox, and cleansing. You see there 17 years out, 8 years, 45 years, high grades 10 years, 17 years. A lot of different patients with long-term longevity from non-Hodgkin's lymphoma just by changing the way they live. Here's a slide we made on the survival impact on low and intermediate grade adult non-Hodgkin's lymphoma from 1978 till the mid-90s when this was made. To date, when this was made, none of the patients that had low-grade lymphoma were deceased. None of the patients that had intermediate-grade lymphomas were deceased. That's a pretty dramatic cure rate, guys. It does work well. And you just saw a case. Here's another one. I love getting these third-party independent corroborations. This is Wenatchee Valley Clinic in Wenatchee, Washington. Sharon was one of the patients. On the left-hand corner there, you can see it says 6/11/92. That's when she came down to see me. And if you look at the CBC, that huge paragraph, all sorts of problems are wrong. She has a lymphadenopathy or inferior, her legs were swollen, the lymph nodes were swollen, the spleen was swollen, the liver was swollen. If you look at the CT scan, it says she had a huge retroperitoneal mass, extends up out of the pelvis, ascending from the pelvis into the periaortic region. It totally encases the aorta, obliterates the inferior vena cava, can't even see it because it's so covered with tumor mass. Huge mass. All sorts of problems with her. Again, look at the date, 6/11/92. Same clinic. I don't know who these guys are. I love getting independent third-party corroboration of what I'm doing, so you can't say I'm biased in anything that I'm doing. Here it is, 2/2/93, which is 7 months later. And she comes back and it says she did not follow conventional treatment recommendations and went for nutritional therapy and coffee enemas in Mexico. Huge change. Remember that great big huge CBC paragraph we had? This one is a 1.25 lines. Inguinal lymph nodes are not clinically palpable. Splenomegaly is resolved. That means your spleen. Lymphadenopathy is resolved. Significant reduction in the tumor mass. Non-Hodgkin's lymphoma, right at the bottom, impression and plan. Dramatic response to the lymphoma with alternative medical approaches. Says she has to work hard in order to get well. Oh, well, it might take a little bit of effort to make yourself well after you've gotten into that kind of trouble, but it does work. And says she wants no conventional medical treatment and wishes to continue with her therapeutic plan. And there's a picture of Miss Lamar drinking a carrot juice out of the hospital, healthy, happy, and whole. The American Medical Association states that chemotherapy, surgery, and radiation, independent of the stage that the patient arrives in, stage 1 to stage 4 or anywhere in between, have less than a 30% 5-year survival rate. What does this mean? More than 70% die. This was 13 years ago. It's worse now. The latest results that just came out, when the war in cancer was started in 1961, cancer rate in the U.S. was 1 in 8. For women, rate today, this is just the latest data from the National Institutes of Health. For women today, it's approximately 1 in 3. For men, even worse, 1 in 2. In spite of all the, quotes, improvements in chemosurgery and radiation, chemotherapy, surgical techniques, radiotherapies like proton accelerators, etc., we are losing the war on cancer. Why does chemosurgery and radiation not do well for the most part? Because chemosurgery and radiation do nothing to change the body's internal biochemistry or the internal environment. If you do nothing to change the reason why the disease starts in the first place, and to change the growth medium the disease grows in, you have much less chance of a long-term cure. Does that make sense?
Of course.
Yes.
Now, that's not to say that they don't have a place. They absolutely do. And I have nothing bad to say about modern medicine. All the guys out there and gals that are working are doing the best that they know how, and they just have never seen anything different, and they're doing what they've been trained to do. Also, if tumor debulking is your end goal, and that's a good valid goal, chemosurgery and radiation do a marvelous job at tumor debulking. So if that's your end goal, great, use it. It does work. And I even recommend occasionally a surgery or maybe radiation. Chemo, probably not, but surgery or radiation, because their effects that they have on the body are localized to the area where the surgery is done or the radiation is done, and it's not so disastrous to the overall immune system as chemo is. But my end goal is not just debulking tumor. The reason why, if you debulk the tumor, that's good, but it's going to come back. You need to get rid of it. My end goal is to cure the patient, and that's what I really try to do.
Yeah, that's great.
The lifetime risk for developing cancer is a startling 45% for men, almost 1 in 2, and 39%, actually a little more than 1 in 3 for women. According to the National Cancer Institute, the most frequent form of cancer is lung cancer, followed by prostate cancer for men, and breast cancer for women. Colorectal cancer is third most common form of cancer in both sexes. Throughout the world, industrialized countries have the highest cancer death rates. Studies show that when people from third world countries adopt Western lifestyles, certain types of cancers, especially colon, breast, and prostate, increase. Very latest info out. Myth: cancer runs in families. Only about 8% of cancers are genetically linked. These usually are cancers that occur in younger patients, like sarcoma or early onset colon cancer. The vast majority of cancers occur without a known cause or are related to lifestyle. 2007. Now is the time to do some serious thinking about our approach to cancer and disease. Not just cancer, disease as well. It is time we look directly at the prevention and elimination of cancer, not just the remission or prescription for cancer. In recent times, some prescription drugs have cured some forms of cancer, and that's true. However, there is still a lot of cancer killing many people. Data from various agencies such as the National Cancer Institute and others show that, listen to this, up to 90% of all cancers are products of our lifestyle, a lack of exercise, exposure to toxic chemicals, and what we choose to eat and drink. The way we live, guys. 90%. Brain cancer. See the white part there on the left-hand side? That's all brain tumor. Glioblastoma. Very dangerous. Kills usually within 6 months to a year. Look at the date, 27 February 86. Here he is, coming along with his therapy. There he is at 30 July 87. A year and 7 months later, almost gone. Little tiny bit of it left. Again, no chemo, no surgery, no radiation. Here he is, totally clear. CT scans done by other people. Love to see it. Freeman Cope, researcher for the U.S. Navy. The date on this is 1978. The very last sentence is the one I want to read. It's about 2/3 of the way down. Some of his hypotheses, they're talking about Gerson, were vaguely stated and incompletely validated, but they are of great importance because they imply that those approaches to cancer therapy that will be effective are mostly different from those now used. Again, the date 78, the heyday of chemotherapy. Remember, it just started in 61. By 78, they figured chemo was going to cure everything. It didn't, and it hasn't. Freeman Cope had it right on the button. Dr. Peter Lechner came over and trained with me. He's the director of the surgical division of the largest teaching hospital in Austria in Graz, 2,000-bed government-run hospital. He did cohort patient studies, which this is. He also did animal model studies. One of the things he found in animal model studies, it comes out of coffee, and when you do coffee enemas, you pick this up. It's called cafestol, and cafestol activates the glutathione transferase system, which is responsible for our cellular immunity. So we get lots of really good stuff out of doing coffee enemas. One of those is an immune system boost. Another one is liver detox. Another one is pain control. Believe it or not, I have patients come down all the time, end-stage disease, on morphine with OxyContin or something else for breakthrough meds every 3 or 4 hours. And within 2 to 3 weeks, I have them pain controlled, maybe not pain-free, pain controlled, and nothing more than coffee enemas and aspirin. No more on the heavy drugs.
Yeah.
Amazing stuff. Dr. Peter Lechner, after 6 years of using adjuvant dietary therapy in conjunction with surgical oncology, we were able to report the following: tumor cachexia prevented or delayed, fewer postoperative complications or infections, lesser side effects of radiation and chemo, significantly less analgesics or psychotropic drugs, good psychological state, slower progression of existing liver mets, less marked occurrence of malignant effusions. Interesting stuff. This is a slide on end-stage ovarian cancer. You can see up to 80% of them are alive and well in stage 3. Stage 4 we actually have documented now, and we need to publish this information if we can get the funding to publish it. But since I'm out of the country, I don't get NIH grants, so I have to pay for it out of HIP National Bank. But anyway, with end-stage ovarian, we've actually documented 63% 5-year survival rates, compared with about 6% with conventional medicine. So that's huge.
Yes.
The most current results for end-stage ovarian cancer show, using the Gerson Plus program, 63% survive 5 years or more. Most cancers are primarily the results of changes that humans have made to the total chemical environment: what we eat, what we drink, what we breathe. This is according to one of Britain's top medical scientists. Again, not all from the U.S., this is from around the world, guys. Sir Richard Dole says that 90% of all cancers are caused by such environmental factors. At least 75% of cancers are associated with environmental and lifestyle factors, say even the most conservative cancer experts. What causes cancer? Medical drugs, industrial products, food additives, alcohol, etc. Putting the two together, she avoided all milk products. Her tumors eventually disappeared, and for 13 years now she has been free of cancer. As this is part of that from China. As Chinese have normal rates of other cancers, there must be a special factor that causes their low breast cancer rates. Also, the largely milk-free Japanese have low breast cancer rates. But when the Chinese or Japanese women adopt what kind of a lifestyle? A Western lifestyle. Again, we're talking about lifestyle, what you eat, what you drink, what you wear. Their breast cancer rates start to climb, approaching the level in Western countries. Studies now link milk consumption to breast and prostate cancer.
Wow.
The biggest killers that we have in this country. Regular mammograms of women with fibrocystic disease are likely to initiate cancer as find it. An anti-cancer lifestyle and regular breast self-exam, on the other hand, can actively prevent cancer as well as providing early detection. And she lists some stuff, and she says these things sound a little scary, but having a biopsy does not increase your risk of being diagnosed with breast cancer. Almost all biopsies, 90%, are negative for cancer. This is a picture of Dr. Max Gerson, the inventor and the ones who started Gerson therapy, a German Jew who fled Germany just prior to World War II and practiced in New York for many years, and moved to Escondido, California, and passed away there in 1959. This is a picture of Dr. Gerson at Baden-Baden in 52 when Issels and Gerson met. And this is a picture of Dr. Issels, one of my favorites. He gave me that picture himself. Great guy, wonderful humanitarian, great doctor, really cared for his patients. And this is a picture of Dr. Issels and myself, one more. He spent the last several years of his life, we worked together, and he's a mentor of mine. I really deem it a privilege to have been associated with Dr. Issels. Great guy. This is Dr. William B. Coley, Memorial Sloan Kettering. He made one of the vaccines that I use. It's the Coley's mixed bacterial vaccine, or Coley's toxins as they're called. Dr. Max Gerson actually stated in his book that somebody should look into it. Well, nobody ever did, except finally yours truly did. And it's a huge immune system booster, and I use that with most of my patients as well. Not just cancer, also with almost any other problem. When you need your immune system activated, this stuff will help do it. This is Dr. Gavallo, the Valentino Gavallo, Russian immunologist, inventor of another vaccine that I use called VG1000, made from human placenta. Really interesting characteristics. Originally started out as a fertility treatment, and found that it had applications for cancer patients as well. Although you won't hear this from the cancer industry or the drug companies that profit from cancer, there is an easy, low cost, and remarkably safe way to slash cancer rates around the world by about 1/3, says the World Cancer Research Fund. What is it? Promote healthy foods and exercise. According to research just released by WCRF, simple changes in the diet and exercise can prevent nearly 40% of breast and pancreatic cancers, 36% of lung cancers, over 60% of mouth cancers, a quarter of kidney cancers, and 45% of bowel cancers. Just changing the way we live. Remarkably, these results were achieved without any mention of vitamin D. By adding vitamin D to the mix, which by itself has been demonstrated to prevent an astonishing 77% of all cancers, Cancer prevention rates approaching 90% overall can be easily achieved. Last month, 2009. This report also did not mention eliminating dangerous cancer-causing chemicals from the diet, such as sodium nitrite found in processed meats like hot dogs, sausage, bacon, artificial chemical sweeteners. It also did not take into account the health benefits of avoiding cancer-causing chemicals in your personal care products. Ladies, shampoo, antibacterial soap, common fragrance, hand lotions, and so on. Instead, choose a 100% natural USDA certified organic version of these products to avoid the toxic chemicals. Again, last month, 2009. Avoiding mammograms, which harm 10 women for every one that it helps, and I didn't state this, there it is, also greatly reduces the risk of breast cancer. A much safer alternative is to use breast thermograms, which offer far more accurate detection without the dangerous radiation. I have a thermography group that I work with in San Diego. And 2 to 3 years easily before you can pick it up on a mammogram, you can see it on a thermogram. A thermogram, all they're doing is reading the heat signatures off your body. You're not exposed to any radiation at all. Great way to have a look at it. If you take all lifestyle changes into account, achieving a 90% reduction in overall cancer rates is quite readily achievable. February 2009. The success of the cancer industry depends entirely on the population remaining ignorant about cancer prevention strategies that are cheap, safe, and remarkably effective. Mammogram and chemotherapy pushers want women to believe cancer is inevitable, a genetic defect that they have no control over. What they refuse to admit, publicly at least, is that the expression of the so-called cancer genes is almost entirely controlled by lifestyle choices. Back to that again. Thus, even a woman whose mother and grandmother had breast cancer can reduce the risk of breast cancer to near zero by simply changing her lifestyle, starting with dietary choices and healthy sunlight exposure. That's where I prefer my patients get their vitamin D. 2009. Anti-cancer superfoods are available everywhere, and I brought a couple of them with me today. If you want, we can talk about them afterwards. These contain potent anti-cancer plant-based nutrients. Cancer simply cannot replicate in an environment containing the right superfood nutrients. Even the dreaded BRCA1 gene, which has women running scared and surrendering to double mastectomies as a prevention surgery for cancer, can be completely nullified through diet, exercise, vitamin D. 2009. Latest information, guys. Patty, lung metastasized melanoma, stage 4. You can see the area that's circled, that's right in her lung there. Look at the date, April 10, that's back in 2000. Here's another one in the other lung. Very dangerous, right against her heart. She also had a tumor on her back, and I told her, Patty, let's remove it. No, I want to leave it there as a marker so I can see what's going on inside. So I finally had to say, okay, your body. After 18 days only on the program, she insisted on going back to New York. Wanted to go to a wedding for a girlfriend of hers. I'm so glad she did. She got rescanned. Tumors are almost completely gone. They're smaller and poorly seen. 64 days later, totally gone. Nothing left. Continued to scan for the next couple of years. Tumor is completely gone, never returned. 3 months ago, I talked to her husband. This is 2009. That was 2000. Has not come back. And here's the kicker. 2 years ago, she had a disastrous car accident, was in a coma for 3 months in the hospital. Everybody thought the cancer was going to come back. It did not. This just shows you how powerful this program is and to what depths the cleansing and the healing take place where you can be in the hospital in a coma and not get your cancer back. Amazing. Totally cured. Melanoma. Again, with diet alone, 100% for stage 1 and 2. Diet and surgery, 100%. Conventional medicine drops her down to end-stage disease, stage 4, 6%. Surgery and diet, 57%. Diet alone, 39%. Amazing stuff, just by changing the way you eat. Analysis of 156 studies linking diet and cancer found extraordinarily consistent evidence that some foods actively protect cells from undergoing cancerous changes, especially breast, cervical, ovarian, and prostate, the ones that really are the big killers. While these foods don't guarantee freedom from cancer, they are vital elements of an anti-cancer lifestyle. The United States National Research Council states that 35 to 70% of all U.S. cancer deaths are related to diet, and that 60% of cancer incidence in women is related to diet. Over and over and over again, author after author after author. There's another one. Might it be possible that cancer is largely due to environmental lifestyle factors and not genetics? A few prominent scientists had already reached that conclusion. The authors of a major review on diet cancer prepared for the U.S. Congress in 1981, and I participated in that. Dr. Colin Campbell, who's the author for this quote, the China study, was one of the peer reviewers. I think that's where he probably really got his start in research in this area. But it was a landmark study done by the U.S. government called Diet, Nutrition, and Cancer, published in '81. And a section in there on Gerson therapy and colon cancer where it talked about a lot of my patients, and the results were there. Estimated that genetics only determines about 2 to 3% of the total cancer risk. The data behind the China Cancer Atlas were profound. The counties in China with the highest rates of some cancers are more than 100 times greater than counties with the lowest rates of these cancers. These are truly remarkable figures. If you haven't read the book, The China Study, I recommend that you get it. It's a great book. Amazing stuff in there. In fact, a friend of mine gave it to me. It sounded boring. I didn't want to read it. I was hooked before I read the preface and the introduction. And chapter 3 is going to blow your mind when you read it. Just briefly, he took lab rats, dosed them with aflatoxin, a real potent cancer-causing agent. After 1 year, he sacrificed them. He had half of them on 5% animal protein diet, half of them on 18% animal protein diet. All the ones on 18% animal protein diet got cancer. The ones on 5% did not. Then he said, well, this is good. I'm going to find out what the life study is. They lived 2 years, so he did it again. At the halfway point, he swapped half of each group. Well, so remember, the 18% group already had it. 5% didn't. At the end of 2 years, sacrificed all the animals. 100% of them in the 18% group had cancer, which means the ones that didn't have it before converted. 100% of the ones in the 5% group did not have cancer, which means they healed themselves on a 5% diet. What does that equate in human terms? About 1 to 8 ounce cup of yogurt a day. And he used dairy products. One of the least offensive of animal proteins, he used casein, dairy protein. So what is it for red meat or other things? Who knows? Because some cancers have a genetic link, if you have a family member who battled cancer, you may feel there's a time bomb ticking inside you. Actually, it's estimated that only 5 to 10% of all cancers might be attributed to genetic predisposition. However, lifestyle remains a significant factor. According to the American Institute for Cancer Research, 60 to 7% of cancers can be collectively attributed to lifestyle choices, including smoking, unhealthy diets, lack of physical activity, and excessive weight. Another author, another article. Here's another one. Family history of prostate cancer is a strong predictor of which men are at greater risk for this form of cancer. This was published in Europe. This is a very misleading statement. Frequently, men hear that they are at greater risk for prostate cancer because their grandfathers died of prostate cancer. But disease that follows along family lines may be due to controllable factors: iron intake, smoking, sun exposure, vitamin D production, infection, etc. Men can make alterations in their lifestyles and negate the risk for prostate cancer. Although there's a debate regarding the specifics of diet in this cancer, we're talking about prostate, let's start with some very safe assumptions that have long been accepted in the research community. Prostate cancer rates vary widely between different countries, even more than breast. High prostate cancer rates primarily exist in societies with Western diets and lifestyles. In developing countries, men who adopt Western eating practices or move to Western countries suffer more prostate cancer. These disease patterns are similar to those of other diseases of affluence. Again, right out of the China study. I was really tickled reading the book. I had no idea. About 2/3 of the way through, here my melanoma studies are mentioned in there as some of the hundreds of studies that he quoted, and I had no idea that we were quoted in there. So that's really cool. It says Hildebrand et al. They usually go with the first name, so my name doesn't actually appear there, but it does back in the section where they have all of the people who participated in the study listed. But it's really cool to be republished again. Another author. It's wonderful to have the opportunity to help men with prostate cancer by using herb supplements, dietary and lifestyle guidelines as their primary treatment strategy to get them well, thrive, and show no apparent signs of cancer is even better. I found that many prostate cancers, even some of the more aggressive forms, included with a high PSA or high Gleason score, even a palpable tumor or evidence of metastases, respond beautifully to natural healing modalities. Absolutely true. I see it all the time. Here's a patient with end-stage breast cancer, had a total right mastectomy. Her breast was removed. The tumor came back. You can't see it really well, but it goes clear back actually to her spinal column, a little tail sticks back there. And if you see her esophagus where the front of the pointer is right there, the tumor is very thick and deep, and it's actually pressing on her esophagus. At this point, she can hardly breathe or swallow. Came down in really bad shape in both lungs, in the liver, long bones, hips, legs, rib cage, full of cancer. There she is after only 3 weeks on the program. She's getting ready to go home. Look how small it is. Look how clear her neck is. She can now eat and breathe without any problems. The tail is completely gone. It went back to her spinal column. And this one's only about this big and a lot thinner. And here she is down at the hospital. This is her husband. He's a pastor in Pennsylvania. The good news is that you can change your statistics by changing your lifestyle. The everyday choices that you make about what you do with your time, what you eat, even what you decide to smear on your body. Remember that very first quote we're talking about? How we dress, how we live? Even what you smear on your body affects your long-term health. Both heart disease and cancer are largely environmental, and by improving your lifestyle, you will reduce your risk of getting heart disease or cancer. See, we're not just talking about cancer. Heart disease, diabetes, lupus, and all these things are so affected by the way we live and what we eat. I sat on several different panels in Washington, D.C. before the Office of Complementary and Alternative Medicine was formed there. Dr. Dean Ornish, New York Times bestselling author, was also there. Dr. Ornish states that the good news is it's never too late to start taking care of your health. In as little as 2 to 3 weeks, you can start reversing the process of atherosclerosis or heart disease by eating a high fiber, high nutrition, low fat diet. Dr. Peter Lechner, the one I talked to about earlier, was also there. And out of our work, the Office of Alternative and Complementary Medicine was formed. Dr. T. Colin Campbell, again, in the China study says, the science is clear, the results are unmistakable. Change your diet and dramatically reduce your risk of cancer, heart disease, diabetes, and obesity. I'm probably the only doctor you're ever going to hear, and I've been saying this for the last several years. Adult onset diabetes, type 2 diabetes, 100% diet, lifestyle control. Change the way you live, change what you eat, cure yourself of diabetes. And it affects now about 300 million people around the world. The issues all come down to 3 things: breakfast, lunch, and dinner. What diseases or problems can be treated with the Gerson Plus program? Almost any psychological problem, believe it or not. Psychiatric problems as well usually can be helped, if not totally cured, by changing the way you live. Almost any disease can be improved with proper diet and lifestyle. Almost any long-term hard to deal with disease or problem can be helped. These include the following and many, many more: almost any cancer, diabetes, heart disease, high blood pressure, MS, arthritis, rheumatism, lupus, scleroderma, kidney disease, various skin problems, etc., etc., etc. Questions?
I have a question.
Yes.
Top close.
A friend of ours was just diagnosed with bone cancer, and she started chemotherapy.
Okay.
And does your program, is it affected by her using chemotherapy at all, or how would you treat somebody like that?
Real easy. 92.5% of the patients in the first 18 years of the practice came in, were extensively pre-treated, including all the chemo, all the surgery, all the radiation they could have, sent home to die. Still healed a lot of them. Yes, we can help. And bone cancers typically come from somewhere else. They're metastasized from breast or colon or some other problem. So I'd like to know more about her. Please have your friend contact me. I'm sure I can help.
Absolutely, yes. Thank you.
Anybody else?
What about the Hoxie Clinic? Is that
Oh
still
yeah, I knew Mildred before she passed away. She was quite a character. Almost everything out there that is having any success in its in treating cancer and other diseases, has Gerson spin-offs in them, including Hoxie. The Hoxie tonic is about half Gerson. And they added a few other things that Gerson didn't have in the program, but most of the base elements for the Hoxie. In fact, if a person is doing Hoxie, I need to watch their Lugol intake because that's part of what Gerson has, and they have Lugol's solution in the Hoxie tonic is one of the components. But almost everything out there, and almost everybody doing alternative medicine will do some form or other, if not multiple portions out of Gerson. Gerson's the oldest one around. It's been there since the 30s, and I've actually been practicing Gerson therapy longer than even Max Gerson, because I've been doing it for more years. He passed away, and I think I've got about 5 years more practice now. Probably the longest practicing physician doing Gerson type therapy anywhere in the world. And almost all the docs that are there that have been around for more than 10 years or so are trainees of mine that are also doing some form of Gerson therapy. But another good example is a lot of the alternative practitioners use coffee enemas, and that's a direct Gerson spinoff. Just multiple ones. Diet also. So they all take spin-offs from Gerson, but Gerson's the oldest, the best known. Hundreds of peer-reviewed articles out there about Gerson, and I can probably send you a list of them if you want to read some of them. A lot of them are in German, but they're pretty interesting. Any other questions?
Yeah, what makes Gerson Plus different than Gerson? So what are you doing that's
What are the plus items? There's about 15 to 20 extra protocols that I've added to the Gerson program. Things like the vaccines that we do. Donopoulos' urea creatine program. Dr. Donopoulos is from Greece. He published in Lancet, the British Medical Journal, the results that he was having by adding urea and creatine. And what they do is, like anything else, tumors want to live too. So they try to protect themselves. And one of the protective things they do is they put up a water envelope around most of the tumors. Well, the urea creatine combination helps to break that water envelope down so your immune system can get at it. So it's just, we use multiple approaches that are non-toxic to try to allow the body's immune system to regenerate and work better, stimulate it, and also to get in and get at the tumors and be able to kill them. Nothing more efficient than your own body's immune system, your own body to be able to search out those individual cells that are still left after the surgery is done. Those individual cells that are still left that are going to go and plant somewhere in another 2 or 3 years, you're going to have a recur. Well, that's why they don't get rid of it, because they don't do it on a cellular level. If you do it on a cellular level like the Gerson program does, where it basically helps to restore your body's ability to cure itself, then that's what really works well. And that's why it's not just a cancer treatment. That's why it's not just a multiple sclerosis treatment. Why it's not just an Alzheimer's treatment. It works for almost all of these different diseases because it's your body curing you. Your body's immune system knows what's wrong with you. It's just not strong enough to get at it. And back when I was in medical school, my friend and I were studying immunology, and I said, I really think probably most of us will get cancer multiple times throughout our life. This was a brand new concept. Wasn't in any book anywhere. This was back in the 70s. And I said, but our immune system is strong enough to get it. And they said, that makes sense. Well, now, as of last year, the experts in the field are now starting to say that almost all of us get multiple cancers throughout our lives, but our immune system is just strong enough to recognize it and kill it. So what better machinery do we have than the one God gave us to start with when He first created us? And that's to allow our bodies to heal ourselves. But if you give it the right building blocks, I fully believe that our body is capable of doing that. The problem is we just don't give it the right stuff when we give it all the garbage out there. So again, all these multiple authors will tell you time and time again, diet, lifestyle, diet, lifestyle. Hello, diet, lifestyle. Do you hear a theme going on? Give your body what it needs, it will cure itself. But there are major differences. I have about 15 to 20 different protocols that I've added into the program that were not in the original Gerson program. Now, do I do Gerson therapy? Absolutely. I do 100% pure Gerson therapy. Bottom line, that's the platform that I use to build everything else on. Because personally, I believe Gerson therapy is the best program out there. And when you add these other things, and again, we looked at the first 2 years of doing the Gerson Plus program and found that we had at least a 25% increase in overall patient survival rates, which is huge. And so I really am impressed to tell almost everybody I can to convince them to do the Gerson Plus. If they want to do pure Gerson, I'll do that. But the Gerson Plus has so much better success rate. Why not do it? And you need to continue to update. I mean, read Max Gerson's book. He continued to experiment, he continued to add and change, and he passed away at 59, wrote the book in 58. So it's been another 50 years, and we need to continue to modernize and upgrade. And that's what I try to do, and not just sit static and repeat what Max Gerson did to start with. Yeah, that's the platform, but then you add all the new stuff onto it. And we've looked at everything out there that we can find. We've tried this and tried that. And what I've tried to do is limit the practice to the things that we found that do the best job for the vast majority of people. Something you can get a good quantifiable response from in the vast majority of people is the things that we try to use. Now, if people want to use other things like the Hebo T or Paldiarco T or SEAC or on and on, there's a lot of good things that do help. And in individual cases, they're wonderful, but they're not as applicable to the general patient with degenerative disease as the things I tried to limit my program to.
Can I ask you the question about the acid alkaline water machines?
Absolutely.
What's your thoughts on those?
Absolutely. An alkaline body is one that typically won't have cancer in it or has a lot more difficult time for cancer to grow. I know that there are a lot of people now selling water machines that do that, and those are good. They're good to use. However, if you change your diet and lifestyle, particularly if you go to a vegan diet, which is no animal products, you will automatically shift your body's internal environment to alkaline. In fact, one of the things that I have to do with my vegan patients is watch them that they don't get too alkaline. Because if you go up to like 8.4 in your urine, you're going to start getting urinary tract infections. So you have to actually reacidify them a little bit. Keep them around 7.5 to 8 is good, urinary pH. But for those who don't want to change the way they live and want to risk their health, then drinking the alkaline water is probably a good choice. But I prefer to do it the real way, the way that God ordained it for us to do, and the way that's going to keep you healthy from a lot of other things besides just worrying about pH factor, although that is one of them.
Can you address something you were mentioning earlier to me about insurance?
Oh, yeah.
That insurance?
Insurance. We don't accept, because we're outside of the country, we don't accept insurance as a form of payment. However, about 80 to 85% of my patients historically do get reimbursed if you have standard U.S. insurance. And that's pretty cool. We have a way of getting that done. And most of the time, most of the patients will get reimbursement. Some get 100%, some get less. It just depends upon what your policy says. But the vast majority of patients can get insurance reimbursement. Yes.
How does this work with heart patients that have had bypasses and
Oh, very well. Excellent question. Heart disease is so
talk
easy.
about it?
I'd love to get heart disease all the time. It's an easy one to treat. The American Medical Association said forever that you could not reverse atherosclerosis, hardening the arteries, heart disease by diet. They just completed a few years ago a study of 25,000 U.S. physicians that showed that these guys were all either already bypass surgeries or candidates for it, and showed that those that selected to do a diet lifestyle change didn't have to have repeat bypass surgeries. Their arteries were clear, and they also have gone to the point now of saying that you can actually reverse it, which I've been saying for almost 30 years. You can actually reverse heart disease. You can actually reverse hardening of the arteries. You can clear those plugged arteries. Normally they're like this. They plug all up with cholesterol and triglycerides. By changing the way you live, you open them back up again so that they're flexible and they work like they're supposed to, just by diet and lifestyle, just by the way you live.
Doctor, can you tell us a little bit about irritable bowel disease?
Irritable bowel syndrome is very easily treatable on this program. I have had patients with irritable bowel, with Crohn's, even bleeding from the rectum. Couldn't have any salads, couldn't have anything else. And within just a few months on the program, they're back eating salads, back eating fresh fruit, totally healing. And this can go on for years and years and years if you don't do something about it. But again, you change your diet, your lifestyle, the way you live, what you eat, cleanse the body, and the body will heal itself. Irritable bowel is totally healable. All you have to do is change what you do.
Do you have any examples of that?
No, this person we're referring to, she is at the stage
She has a
where
colostomy
she's got a colostomy bag.
Okay,
So
let's
it's-
talk about colostomies for a minute. Colostomies are not just from irritable bowel syndrome, they're also from cancer. In fact, I just have an Amish patient now that is on the program from colon cancer with a colostomy. As of about 3 weeks ago, she underwent her colostomy reversal procedure. And I have this happen over and over and over again. I've even had patients come down that supposedly were irreversible colostomies that they had put in, and we've been able to reverse them. It just depends on what anatomy is left when they're done. But yes, if you can heal the disease, which we usually can, then you can reverse the colostomies. And what a huge lifestyle change it is for the patients. They don't have to walk around with that stinky bag and carry them everywhere they go. They're back living a regular, normal life. And yes, you can do this over and over and over again. Does it work always 100%? Absolutely not. Do I have failures? Yes. But the vast majority of patients, it works for if you just follow the program. And most of the time when they fail, it's because they don't really follow the program like they're supposed to.
And Doctor, you have this program for
Yes.
someone at home who does not have a disease that is at least.
That's the good, healthy
Well,
vacation that you
that's
come
right.
down on, the
You come
wellness
down and you
vacation.
find out about
Yes.
it. Okay.
And you can also do it on an outpatient basis if you want. But some just want to come down and be pampered and have all their juices delivered to them and have all their meals prepared for them and learn how to really live properly. And that's a good investment in your health and in your future.
So what I'm hearing is that education is a primary factor here. So I want to know your suggestions. How can we have better education starting with our youth and really devote to wellness and stop this insanity of creating illness?
Amen. I agree with you. It is the positive duty of physicians to educate, educate, educate by pen and voice. All who have the responsibility of preparing food for the table. That's what I'm trying to do. My wife has been after me now for several years. You got to write your book. I'm starting. I've got parts of about 8 chapters done. So hopefully within the next year or two we'll have a good book out. I've already have a small one that anybody can get, and it's like I said, it's only like $5 for an ebook, and it has all the basic principles in there of how to make your juices, how to make your food, what a typical menu is, how to do the coffee, how to do the coffee enemas, all that kind of stuff. So it's simple, it's quick, it's easy, and it's cheap. It doesn't have to be expensive to have good health. Thank you so much.
Thank you.